Good evening. This is Scott Kyber reporting for It Pays to Shop Southlake and the Great Southlake Chamber. We've just concluded the Jenny Brown Waite Healthcare Town Hall meeting for mostly physicians and doctors and nurses at the Southlake Chamber this evening. I have CEO or President CEO of the Southlake Hospital, Ms. Leslie Longacre, and we heard so many neat and interesting statistics, but one of them that I remember from the town hall meeting today had to do with a shortage of skilled personnel for nurses and doctors and these things. So would you tell us more about this planned bill and the legislation that's coming up, whether that's going to help or hurt the shortage?
Sure. Right now we have a shortage of primary care and general surgeons in the state of Florida and across the nation. Having access to health care for many million more people is only going to exacerbate the shortage, because people are going to try and access care and won't be able to because there are no providers out there to take care of them. So we need, the predictions are that we need 40,000 physicians over the next few years in primary care to be able to service the uninsured and underinsured that we have today. Additionally, nurses, we can't run hospitals without nurses, and the nurses is an aging population today. Their average age is between 44 and 46 years old, and to replace those nurses, we need more graduates, and to get more graduates, we need more programs, and medical and nursing programs are extremely expensive in the universities and colleges. So it's going to be a real concern going forward. It's a concern today. It's going to be a real concern going forward. Not only nurses and physicians, but other healthcare providers such as pharmacists, rehabilitation folks, and other clinical positions.
And since we're from Southlake County, how does that really affect and relate to the kind of care that I can expect to get maybe 6 months or a year from now when the possibility of the bill gets passed?
Well, Southlake Hospital has been recruiting physicians for the last 20 years, and we continue to recruit physicians, even if those physicians are not members of our medical staff. So we are attempting to meet the community needs by recruiting primary care physicians into the community. So we will continue to do that. The problem is going to be, are there enough physicians to come into Florida? Are they going to want to move out of somewhere else, or are they going to be enough graduates to come in and take care of the population? But we're working on it. We're trying really hard.
And does Florida have any advantages or disadvantages in terms of recruiting these kinds of highly skilled physicians and nurses?
Florida is known as a very high med-mal state, which is, suing and physicians and hospitals and others. And we don't have really good tort reform. A few years ago, we tried to put some measures in to make it better, and we did a little bit. But people are still afraid of Florida, coming to Florida because of the med-mal.
And will any of that change with the new bill?
No, there's nothing in the new bill, to my knowledge, that has anything to do with medical malpractice or tort reform.
Well, thank you so much. I know that you had a long day, too, participating in the town hall meeting today. That was about 700 attendees. And thank you for coming out tonight as well. We appreciate your work that you've done for the Chamber in the past. And we wish you the best of luck in all these challenges that we seem to be facing.
Thank you very much.
Thank you.